what are the structures that are passing above the sciatic nerve? So all of you look at this picture which I am drawing here. All of you just concentrate on this picture. Let us say this is the back of your, the posterior region of your leg, right? So this is a posterior region of your thigh, and down here you have got your leg. Okay, right. Second important thing is that all of you know you have got a muscle like this, right? The major gluteal muscle, what is that? That is your gluteus maximus. So this muscle over here is your gluteus maximus. Okay, and you know you have got biceps. So there are two heads of biceps. One is called as a short head, another one is called as a long head. Let us say that here we have got the long head of biceps. Okay, so one is gluteus maximus and this is long head of biceps. Let me write it down. So this will be your gluteus maximus and this is long head of biceps femoris. Long head of biceps femoris. Now exactly here guys, you have got a nerve. Okay, so there is a nerve with the dotted line which I am drawing. This is present behind the gluteus maximus and this nerve is coming down like this, and again it is passing where? It is passing behind this long head of biceps femoris and then again it is passing down. So this nerve over here is your sciatic nerve. So sciatic nerve is passing below what? It is passing below gluteus maximus and long head of biceps femoris. Right, so these two are the structures that are passing above the sciatic nerve. Above the sciatic nerve or sciatic nerve passing below them, both of them are the same, right? But all of you just look here, I'll shade one region. This is the exact region where the sciatic nerve is naked, right? It is not covered with any muscle here. So exactly at this region, for example, if you are sitting on a hard edge, right? So for example, let us say that there is a short bench. Right, on the short bench you are sitting there and the surface, lower surface is really hard. So what will happen, the edge of the bench, whatever is there, right, so the edge of the bench will be compressing the thigh region, yes or no? So whenever you sit on a hard surface for a long time, after some time on the posterior region of the thigh you will have some kind of weakness, right, paresthesias you will have. So you will have paresthesias and that condition is caused by compression of sciatic nerve exactly at this point. Okay, so exactly at this point. So this condition you call it as sleeping foot. Okay, what do you call this condition as? Sleeping foot. So this part right here, the sciatic nerve is uncovered. Sciatic nerve is uncovered. Uncovered where? It is uncovered between gluteus maximus and long head of biceps. Gluteus maximus and long head of biceps. Long head of biceps. Okay, so second important thing is that because of this, what is happening? Because of this, the sciatic nerve undergoes compression because of sitting on a edge, hard edge. Okay, so this will cause compression. When it will cause compression? Sitting on a hard edge. So when there is compression, what will happen? Patient will have paresthesia. Where will the patient have paresthesia? He will have paresthesia on the posterior side. Okay, so he will have paresthesia on the back of the thigh. Back of the thigh. So if you are sitting on a hard edge for a long time, so that would lead to compression of this nerve exactly at this particular location. So that would lead to paresthesia, and this is called as sleeping foot. This condition you call it as sleeping foot. Sleeping foot.